I'll present the challenges related to recruitment and retention, but especially for bilingual professionals in mental health. And I explain the issues related to bilingualism also in the health network. I work at the CIUSSS of the western part of the island of Montreal, about 2 years, and we have about 13,000 employees, 880 physicians, a budget of $1 billion. It's a fairly big hospital. We have two major research centers, one in mental health and another one. As far as large centers, it's bigger than Rona and Lowe's Canada as far as the number of employees. So it gives you an idea of the size of this corporation. We have three community hospitals, two research centers, GMFs or family medicine groups. There are also CHSLDs or long-term care facilities, one, the Mental Health University Institute, Douglas Institute in mental health. We also have a CLSC for rehab centers. Roughly, we hire about 2,100 new hires every year, and we receive roughly 4,500 interns, medical, resident, university internships, college and professionals. So, and roughly 65% from McGill. So the majority of our sites west of the island of Montreal, since we serve partly Anglophone community, many of our sites are designated according to the law, according to Section 508. So designated facilities doesn't mean that we have to be bilingual for everything. It means that we have to offer services in English to the Anglophone population who needs them. It doesn't mean that we must only be Anglophone. We have to be able to offer in French, but also offer health and care in English to the population. So designated facilities, we're not the only ones. There are several in the province of Quebec who are like this, but for most of them, it's in the greater area of Montreal. Another challenge is Bill 96. Well, it's a challenge, but something we have to work on. Is the Bill 95 is on the official language of Quebec. We have the obligation of communicating with the employees in French, but we can also do it in English. So generally, our communications must compulsory in a compulsory industries must be in French, but sometimes we also do them in English to reach as much personal as for many it's bilingual, but it might be easier in English for some, but they speak English or French. Also, since we are a designated facility, we have to offer services in French at all time. We have to be able to offer services in French or in English, since we have facilities that are designated for the Anglophone population. Obviously, bilingualism is a huge advantage. If you're fully bilingual, it's better. But in the health network also, it's always an advantage. Now, the mission of our CIUSSS, we have the Douglas Mental Health University Institute. It's very recognized academic environment for the quality of work. It's recognized globally for mental health. There are many things that are being developed here which are recognized throughout the world. There's also a therapy for psychosis, which includes research. It's the only one in Quebec. So we serve Anglophone population and the Francophone population. Another important aspect, we have the Batshaw Family and Youth Center. It's mostly for youth, obviously, and it serves the whole Anglophone population, and even if there are residents in rehab, youth coming from throughout the province who need it. They come here for English. So if you're bilingual, it's better because we really serve Anglophones and Francophones. We are one of the CIUSSS, which is, I would say, most bilingual as far as our operations. Now, the challenges. I was asked to speak about the challenges for attracting and retaining, well, the impact of the pandemic. First of all, it had a huge impact, the pandemic, for the health network, but on the job market in general also. So far more difficult to find personnel, especially in health, people who have health diplomas. There are many changes in the practices that were implemented during the pandemic and after. We didn't talk about Teams or Zooms or remote work. Telepractice, telehealth, maybe a bit, and for psychologists and so on, but more and more, these are words that we use, and nobody today can say that I work full-time uh, uh, in person. There could be telepractice, the remote work. Another issue that was the problem of reconciling family and work. People thought about this and no longer, as an employer, we can no longer offer full-time positions. We have to offer full-time positions or people will work 2, 3 days a week. The best example, psychologists generally in the health network will work maybe 2 days a week for the public, but 3 days also in the private. So we really have to be very flexible because this is part of the new reality in 2023 and 2024 and for the coming years also. There's also the image of the health domain, which had a huge impact. People appreciated the people who worked in the health network, but it had a positive impact, but also a negative impact. The image of the health network, the pressure and all that means that for the perception of the general public outside, it can be a perception which is often negative. But we have to look at the bright side and for health after the pandemic, especially for mental health. We know that there are many needs. So there's this aspect we really have to push on this. The other aspect which is important is competition, which is very strong to attract and retain staff. There is a shortage of labor, there's competition between the private sector and the public sector. Psychologists, for example, in the private psychologists, in the public, nurses, I can give that example too. There's a lot of competition. The salaries are not the same and the working conditions are not the same either. Pension fund, defined benefit, perhaps better salary, better schedule, but there are very different conditions on either side. And often we'll see people who work 2, 3 days, for example, as psychologists in the public, and they'll work the rest of the week in the private sector. There's also competition between the provinces to recruit and retain. New Brunswick, for example, will come into Quebec to get bilingual employees. Same thing for Ontario, and we do the same thing too. We'll go see if there are employees that are interested to come and work back home. But even for the province of Quebec, the Department of Health, they also do it. Another aspect which is a challenge is the unemployment rate, 4.3% in Quebec in August. It's one of the lowest. It's the lowest unemployment rate in the past 40 years, and we've been there for several months. So shortage of labor, employees who have different working schedules, low unemployment rate, it's a huge challenge. Another important challenge for us for the CIUSSS is the need to have a bilingual people who can speak French. It's good. People who speak English, it's also great, but it's to be able to have both, to be able to have a dialogue with the employees and the patients. It's mostly in the region of Montreal that we'll find bilingual staff. I'll present the challenges, but there are also some brighter sides. There's also the number of graduates coming out of the schools, which makes recruitment very difficult. The number of graduates is probably not sufficient to satisfy the needs of the whole health network. Back home in the CIUSSS, we'll go get nurses, psychologists, social workers. We have a lot of need for personnel, so it's really a daily issue to go recruit and also to retain our personnel. The other aspect is the age groups. Some people are headed towards retirement. You only want to work 3 or 4 days, but for a very different reason compared to those who are just starting their career and who might want to work 2 or 3 days per week, but to keep time to do something else. And the sandwich generation who say, well, I have children now, so I want to be able to go home after so many hours at work. So we really have to have a lot of flexibility for these various age groups and also the means to retain and build loyalty are not the same. Youngsters, will say, if you don't offer this to me, I'll go see elsewhere. I'll go work elsewhere. And people who are closer to retirement, well, if you don't offer it to me, well, probably I'll just accelerate my departure towards retirement. Otherwise, I'd stay longer. So we really have to adapt ourselves to keep people in the job market. Before, the employer would choose his employees. Now it's the employees who choose their employer. When we do interviews, I can guarantee that the interviews it's in the other direction. What are you going to offer an employer? I see several employers, and what do you have to offer me? It's not the contrary. So we really have to adapt ourselves. And what I'm presenting here is true for the health network, but it's also true throughout the whole job market. Now, attract and retain. What's important, what we're implementing at this CIUSSS of the west part of Island Montreal, is to remain agile as an organization, to remain agile so that we will be well adapted to telepractice, remote work, and technology. We have to have flexible schedules. Some people say, I want to work 5 days online, 3 days on holiday, and we constantly have to adapt. It's an obligation to be able to remain agile. There's another thing we do internally is we offer French and English courses. Some people will be hired almost unilingual, but they might be able to speak a few words of French, and we offer the French courses and English courses. We even have connections with McGill University concerning this, and we'll develop this even more. We can't just wait for bilingual people. We have to offer everything, and that's what we also do in the facility. We offer these training. Another thing we do to improve recruitment is the fast track for interns. It means that interns who come do an internship, they work with colleagues, and as soon as we have the information that, hey, Jean-Philippe Ferland, it's a great intern, future psychologist or a social worker, we open the file, we don't do an interview, we just open the file and welcome here. So we fast track them. They don't go through interviews. They've already done everything by being interns. So these are ways that will make recruitment easier and to remain competitive. The other aspect is you ask people at the grassroots level, what can we do to improve? Even for mental health, there are all kinds of things we can do to improve. And it's not always, the big bosses who have the best ideas. It's up at the grassroots level. We can use other types of job, criminologists, psychoeducators, social assistant technicians. Other job titles can be in they're complementary to go help the other health professionals. So we try to work a lot with the grassroots level, the people who work on the floor. If they have ideas, how can we can attract and retain, and especially how we can improve the working conditions here. So we listen to them, and we can't just do it this year. It's every year, every week, every month. We always have to reinvent each other. Also limit hiring requirements. Before, we wanted to have a psychologist or the professional with 10 years of experience, 5 years in a specialized domain. Now, today, we can't do this anymore. What we do is we limit the maximum of requirements mostly for the years of experience, and we train them internally. We take them and we train them. If not, we'd never be able to recruit, and we'd never be able to have staff. We also use more technologies, for example, telepractice, telemedicine, telehealth are things we do. There's also work that's done to increase the number of graduates in the school. There's not enough graduates, but there's the scholarship called Perspective Québec that was implemented for people who want to come and work in a health network at the CIUSSS of the Ouest de l'Île Montréal, and in their training they receive 2,500 per session, and it's 1,500 for certain types of job titles. Recently, there's another scholarship, which is good for the health network in psychology, a PhD, $25,000 to help people who want to remain in the health network. So 25,000, you commit yourself for 2 years at 3 days a week. So these are strategies that are being implemented for the network and to try to help us. Another thing we're doing, I have 15 minutes, so I have to go quickly. It's to continue international recruitment. We do it as a facility, but we also do it with other health facilities, and we do recruitment with the other provinces. The objective is to find resources abroad because the number of graduates is not high enough. And the graduates, well, you're lucky. As far as capacity and possibility of working, there's all kinds of possibilities. So we really have to distinguish ourselves. And that's why I'll give you a few examples of things we're implementing for the issues. So to conclude, hiring is not the exclusive solution. We often talk about, we have to improve the situation. We can't just hire to solve the problem. We have to work on hiring, but we also have to work on retention. This is what we offer, and this is what we'll do to keep these people. As an employer, we have to reinvent our actions to attract and retain personnel. If ever you have an employer who says, this is it, it's good for 1 month or 2 months. No, there will be other new things that will be done, and there's a whole multitude. We have to constantly reinvent ourselves, mostly in our case, with the importance of having bilingual staff. So if you speak French or English, it's always good. And we'll be very open to help you, even it's a little bit of French. We will really be there to help you to develop that whole aspect. I'll conclude with a small picture. Often people say Einstein didn't really say this. It's okay. It doesn't matter if it's not Einstein. But being crazy is doing the same thing over and over again and expecting a different result. In the health network, we have to reinvent ourselves. We're short staffed. We have to find a way to attract them and keep them. I give you a few examples, but that shows the challenge that we have every day with hiring and retaining our staff. So I'll conclude with this. And if there are any questions, I remain available.